Hi guys, here we have Roots of Drug Administration Part 2. So we are going to learn the systemic route here. Is the second part of the route of drug administration. So what is systemic route? The drug administered through systemic route is intended to be absorbed into the bloodstream and distributed all over, including the site of action through circulation. So whatever the drug administered into your bloodstream is distributed all over your body, including the site of action. Site of action means for whatever you have taken the drug through circulation via blood. Okay, the systemic route is divided into two parts. One is enteral and the second one is parenteral. Enteral route is again divided into four parts: oral, sublingual, rectal, cutaneous. We are going to discuss this in brief in the other slides. Then parenteral is also divided into inhalation, transdermal and injections. These all are the part of injections like intravenous, intramuscular, subcutaneous, intraarterial, intraarticular, intrathecal, intradermal. So let's go to the next slide. Here we'll learn all the route of drug administration through picture. First is oral. I think this you all are aware of, that is in tablet form, which we directly take from the mouth. The next is sublingual. Sublingual, you can see here a kind of a tablet which is kept under the tongue, or you can say a little beneath your tongue. Slowly and slowly dissolve there. We don't take it with water. It just, we have to keep it under the tongue and it get dissolved. Okay. Then the next one is rectal. You come here, rectal, like we take it in a form of suppositories, which we have learned in the last lecture. What are suppositories? This we keep in the rectal and slowly it get dissolved into your body and shows its effects. The next one is cutaneous. Cutaneous is not described in the diagram because cutaneous is taken over the skin like kind of a spray, some gel which we put over the skin and it get dissolved inside and shows it effects. Next is inhalation. Inhalation is usually asthmatic drugs which we take as a form of a spray inside your mouth. Transdermal injections. Here are so many injections. First is enteral route. Here we'll study about all the routes in detail. Oral. Oral injection is the oldest and commonest mode of drug administration. It is safer, more convenient, does not need assistance, non-invasive, often painless. The medicament need not be sterile and so is cheaper. So oral is usually tablets, which you guys are aware of. Next is, I'm not going into the detail of oral. Next is sublingual or buccal. The tablet or pellet containing the drug is placed under the tongue or crushed in the mouth and spread over the buccal mucosa. So again, these are the tablets which we have to keep under our tongue or beneath the tongue, and we have to crush it. Not all the tablets we have to crush, but it get dissolved and gets, actually it is soluble, lipid soluble and non-irritating drugs. So this get absorbed under your tongue and shows its effects into your body. Next one is rectal. Certain irritant and unpleasant drugs can be put into rectum as suppositories or retention enema for systemic effects. This route can also be used when the patient is having recurrent vomiting. However, it is rather inconvenient and embarrassing. Absorption is slower, irregular, and often unpredictable. So, in rectal, we have so many side effects, you can say, because it is inconvenient. Putting some tablet or some capsule inside your rectum is little bit painful. Absorption is slower. The absorption of suppositories are so slow, irregular and unpredictable. Like you cannot judge whether it is going to dissolve inside your body or it will not. Next one is cutaneous. Highly lipid soluble drug can be applied over the skin for slow and prolonged absorption. The liver is also bypassed. The drug can be incorporated in an ointment and applied over specified area of skin. Absorption of the drug can be enhanced by rubbing the preparation. So what we have learned in this one, cutaneous is a ointment usually which we apply on the skin. It get absorbed through the skin and drug shows its effect. Okay, let's go to the next slide. Next is parenteral route. First one is inhalation. Volatile liquids and gases are given by inhalation for systemic action. Example, general anesthetic. Absorption takes place from the vast surface of alveoli. Action is very rapid. In this path of administration, the drug is run to the respiratory tract. Inhalation therapy is the top choice for respiratory organ diseases like asthma, cystic fibrosis. So I've told you already that asthma is very common for inhalation. You might have seen some people are taking some kind of drugs through the mouths and they are pressing or putting something on their mouth. They do like this. They inhale the drug inside. Next is transdermal. Transdermal drugs can be expressed such that a patch consists of the drug is rubbed to the skin. The drug escapes out of the patch throughout the skin at a prearranged and controlled rate and into the capillary bed. The penetrated drug is transferred by bloodstream to the complete body lacking the first pass metabolism. Okay, transdermal is in a very common way. If I tell you, it is something you have used bandages in your daily life. If you see if you are getting some cut, some kind of bruise or anything, you'll put some bandage. That bandage have a little patch. Sometimes it is in yellow color, sometimes it is in white color. That patch has consist of drugs which you put on the skin and it absorbs the drugs from that patch and shows it effects. Okay, one word here is first pass metabolism. What is first pass metabolism? First pass metabolism refers to the combined action of drug metabolism by the liver and the gut. Means if you are taking some kind of drug, it just passes through livers and the guts. The next one is intravenous. Intravenous route involves the transfer of a drug solution through a needle directly into a vein. In this route, the medicine is injected within the vein lumen, mostly the antecubital vein, that is superficial veins, in the system of bolus or as an infusion. Okay, intravenous is very common, which you can see in your daily life is injection. You know why, guys, I'm giving you the simpler and the easy example so that you can understand these terms so easily. I know you'll get some better example of these drugs in your books or somewhere else also, but I am just making it so simpler for you guys that you can understand by the term only. Okay, we'll go to the next slide and learn. Okay, here comes the injection routes. Like I have told you, there are different kinds of injections. So what are the injection routes? First is subcutaneous. Administration beneath the skin, hypodermic, synonymous with the term subdermal or hypodermal. That means the injection which is given to the layer of the skin, like it is just above the first layer of the skin, like this is the first layer and just below this, that is subcutaneous. What is intramuscular? Intramuscular is administration within a muscle. The injections which we use to give into the muscle are intramuscular. Next is intradermal, administration within the dermis. There are so many layers of skin in which dermis is below the subcutaneous, like hypodermic. So intradermal is given to the layer of the skin which is dermis. The next one is intravenous. Intravenous is the regular one which we usually give administration within or into a vein or veins. That means the injection which is given into the vein. Actually, we have two blood streams. One is vein, the second one is arteries. Okay, so the intravenous is which is given into the vein, and the intra-arterial is which is given into the arteries. Okay. Next one is intrathecal. Injection is given part over the cerebrum joining to the spinal cord, known as intrathecal. Okay, so what do peritoneal means? Peritoneal means a membrane, a sheet of smooth tissue that lines your abdominopelvic cavity and surrounds your abdominal organs. So this is a membrane which is present inside your abdominal cavity. Okay, these two are little different, so you have to learn these two terms. Okay, intravitreal. Intravitreal is the administration within the vitreous body of the eye. Like some of the injections are there which are given into your eyes, that are intravitreal. Okay. Now here is the comparison of the intramuscular, intravenous and subcutaneous route. First is site of administration. In intramuscular route, large muscles include deltoid, triceps. Triceps, I think everybody knows. Triceps is given into the deltoid or triceps. Intravenous into the veins, subcutaneous tissue below the skin. Okay. Depot preparations. What is depot preparations? Like with a mixture of. So intramuscular can be made, intravenous cannot be made, and subcutaneous can be made. Absorption speed of the drug, like how much time each of them takes to get absorbed into the body. In between intravenous and subcutaneous means whatever the time intravenous and subcutaneous is taking, it comes in between two of them. The intravenous is the highest and subcutaneous is the slowest. So intramuscular comes in between highest and slowest. Feature: drug volume that can be administered. In intramuscular, small volume of the drug can be administered. Intravenous, large volume, and subcutaneous, again it is small volume. Bioavailability, it's calculated in percentage. It is 75 to less than 100. Intravenous route is the 100%. Again subcutaneous is the 75 to less than 100%. What is actually the bioavailability? Bioavailability tells the absorption of the drug. Onset of action, like we are giving the drug into the vein, but that doesn't mean that is the site of action. So how much time it takes to reach its site of action? Intramuscular 10 to 20 minutes, intravenous 30 to 60 seconds. This is very less. Okay, subcutaneous 15 to 30 minutes. That's why you have heard of, like whenever you are giving intravenous to someone, you have to be very sure that what you are giving, because there is just a quick of time and everything can be destroyed. Assistance means you need to take these drugs in someone's assistance. Intramuscular, it is required. Intravenous, it is required. Subcutaneous, it is not required. That means subcutaneous you can take it by your own as well if you are capable of. Irritant drugs. Soft irritation causing drugs can be given can't be given. That means if intramuscular or intravenous or any of the drugs is showing any kind of irritation, in intramuscular, if there is a soft irritation is causing by the drug, it is fine. Intravenous, if there is irritation, it is fine because intravenous shows irritation. Subcutaneous, if any kind of irritation you feel, you can't take subcutaneous drug. Risk frequency. Risk frequency is lower than IV route. Risk frequency in intravenous is high. In subcutaneous, it is low. I told you it is in intravenous. You have to be very sure before giving the drug to anyone through intravenous, because it is very critical if you give the drug to some other veins where it is not required, where you can't give. If you do so, it can harm anyone's life. Okay, so be very careful for intravenous route. Okay. Oh, sorry, it is end. Thank you very much. I think the route of administration is over now. Thank you so much. If again I'm saying, if you want to know anything, please just tell me. Okay.